You know, when you're in a hospital, you're putting your trust in a lot of things. But have you ever stopped to think about the equipment itself? Like, what guarantees it's actually safe? Well, it's definitely not just hope. Today, we're going to pull back the curtain on the hidden, super rigorous process that builds that trust, one test at a time. Okay, so take a look at this. This is a perfusion tubing set. During a major surgery, this thing is literally a lifeline. So, when a life is on the line, how can we be absolutely 100% certain that every single piece of it, right down to the plastic it's made from, is not going to fail? That's the big question, right? The answer is something called validation. You can think of it like this invisible safety net. It's a process of proof, step by step, that makes sure safety isn't just a promise someone makes. It's a fact, a verifiable, provable fact that's built from the ground up. And that journey starts in the most basic place you can imagine. We're talking about these little things, the raw plastic pellets that will eventually become the tubing and other critical parts. It all starts here. So, before a single thing gets made, these raw materials have to go through their first round of really tough tests. This is where quality control kicks in, at the very beginning. One of the first, and honestly one of the most important of these tests, is called tensile testing. The best way to picture it is like a super scientific game of tug of war. A machine literally pulls on a sample of the plastic to measure exactly how strong it is and just how far it can stretch before it snaps. And here's what the results look like. The standard says the material has to handle at least 30 megapascals of pressure. Don't worry about the term, it's just a unit for force. Well, this sample measured 32.5, so stronger than it needs to be. That is our first big, satisfying pass. Next up, we've got hardness. This is super important. You don't want the tube to be so soft that it collapses, but you also don't want it to be so hard that it's brittle and cracks. This test is basically checking how well it resists getting a dent. It's kind of like pressing your thumb into a piece of fruit to see if it's ripe. Just, way more precise. And just look at the precision they're looking for here. The standard demands a hardness somewhere between 70 and 75 on what's called the Shore-D scale. Our material, it came in at 72, right in that perfect sweet spot. So that's another critical pass. Now, we've only looked at 2 tests. But in reality, this raw material goes through dozens of tests like these, checking everything you can imagine. Every single one of them has to get a pass before they can even think about starting manufacturing. Okay, so the raw plastic is good to go. But what happens when you start making thousands of these parts? I mean, you can't test every single one. That's impossible. This is where statistics becomes an absolute lifesaver. Let's just imagine a factory makes a big batch. They call it a lot of 10,000 identical little components for our tubing set. So the question is, do you sit there and test all 10,000 of them? No way. Of course not. It would take forever, cost a fortune, and you'd literally destroy all the parts you just made. So how do you know they're all good without testing them all? The answer is pretty brilliant, actually. It's called a single sampling plan. It's a powerful statistical trick that lets you figure out the quality of the entire huge batch just by testing a small, totally random sample. And you have to see how this works. It's kind of dramatic. For that batch of 10,000 parts, the plan says, grab a random sample of 200. Now, if you find 10 or fewer defective parts in that sample, the whole batch of 10,000 passes. But if you find 11, just one more, the entire batch gets rejected. The fate of thousands of parts comes down to a single one. That's some high-stakes quality control. All right, so our raw materials passed. The individual parts have passed their sampling tests. Now it's time to put it all together into the final product. But we're not done yet. In fact, the testing is about to enter its most critical phase. So you can see this beautiful chain of proof we've been building. You test the raw material. You test the individual parts. And now you test the finished product. Every step is a checkpoint. Once it's all assembled, the product gets hit with a whole new wave of tests. We're not just worried about how strong it is anymore. Now, the big concern shifts to things like making sure it's sterile and, crucially, making sure it's fundamentally safe to be used in a human body. And that brings us to what I like to call the final boss of testing, biocompatibility. This is it, the ultimate proof. It's a whole series of tests that confirm the device won't cause any toxic or harmful reaction when it touches a patient's blood or tissue. This is the test that directly answers our first big question, is it safe for a human life? So, we've gone from tiny plastic pellets all the way to a finished, sterilized product that's passed every test. So what? What's the big takeaway here? Why do all of this? At the end of the day, it's all about this. Trust isn't something you can just assume. It has to be built, and it's built by this chain of pass results, where every single link is a piece of certainty, connecting a simple raw material to a product you can literally bet your life on. This really says it all, doesn't it? Trust isn't a feature you can just list on a box. It's what you get at the end of a long, meticulous, and completely verified process, just like the one we just walked through. So the next time you see any complex product, I mean anything, from the food you eat to the plane you fly in, it's pretty cool to stop and ask, what's the invisible process? What's the chain of proof that allows me to trust this thing? Because chances are behind it, there's a story of validation very similar to this one.